Dr. Amanda from StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to talk a little bit more about Ceph X-rays, standard of care. Do you need a Ceph for your aligner case? Um, so I'm going to kind of tell you my opinion, which may differ from another orthodontist's opinion. It really ultimately, first of all, I can tell you my opinion based on where I practiced, but that doesn't mean the country or the state you're in has the same Dental Practice Act, the same standard of care. So you really need to dig into your own laws in your own state or your own country to answer this question. I cannot answer it for you, but this is my opinion. So a Ceph, what do I get from a Ceph? From a Ceph, I take it. A lot of orthodontists, honestly, they take them. They don't do anything with them. It just goes in the chart and they take them because somebody told them to take them. Well, I don't really believe that you should be irradiating a patient if you're not going to get something out of what you're doing. There's risks, benefits, and alternatives. If I don't have anything to gain from taking this X-ray, why would I take this X-ray just because somebody told me to take the X-ray? That doesn't make any sense, right? Because any type of radiation is a small risk to the patient. So I need to have a reason to take the Ceph. So do I personally take Cephs on class 1 adult patients getting Invisalign? No, I do not. Okay, because I'm not going to use it. All I'm going to do is straighten the teeth. What is the Ceph for? What do I have to gain from a Ceph? Well, Ceph helps me make decisions. It helps me qualify the decision. It helps me quantify the decision. It helps me make decisions. It helps me make treatment decisions. It helps me explain treatment decisions. I can take a Ceph like this or like this, and I can get a lot out of it. But I can also look at the patient's profile and bite, and sometimes I don't think I'm going to need it, use it, or there's no benefit to taking it. So when would I take a Ceph for an Invisalign patient? Yes, sometimes I do. So if it's a patient, let's say this patient has overjet, okay? And I'm like, goodness, should I distalize all the top teeth or should I just add some anterior IPR or should I try to use elastics to bring to tip the lower teeth forward? In an adult, I have 3 different ways I could go. I'm not quite sure. I think I know, but let me look at the X-ray and maybe it'll give me some guidance, or let me it'll give me some ideas of what things would look like if I went with treatment option A, B, or C. So that's why I might take one, right? That would be for an adult. Same thing. I want to see how proclined are the incisors. Can I procline them more, or is it going to take me into an unstable zone, a standard deviation outside the box? So I can kind of tell by looking at a patient, but sometimes when I look at the X-ray, so for example, let's compare this to this, okay? These incisors are upright, right? So if we ran it through the Ceph metrics, the analysis, it would take this and it would tell you exactly what I'm seeing. These incisors are upright, right? It would probably also say that this one has a small lower jaw, okay? What else can we find in Cephs? We can see airways, nice nasopharyngeal airways, see if they're open, see if they're closed. I can see adenoids. I can see angles of incisors. I can see small jaws, big jaws, long jaws, short jaws, all kinds of things. So it helps me make decisions, okay? Now we compare these upright incisors to this. Wow, they're very proclined here, okay? So like, for example, for this patient, and I can see this, I can also see the soft tissue, I can also see the profile. This patient kind of has a bit of a convex profile, kind of flat lips. If we drew an E line here, you'd see the lips were behind the E line. Certainly here, I'd be making treatment decisions that would enhance the profile, not retract the profile. Whereas here, if we drew the E line, this patient's lower lip is way ahead of the E line, okay? So I would be making, and they're very proclined, so I'd be making decisions that maybe would retract the lower incisors, but maybe keep the upper incisors where they are. Or if this patient was growing, maybe I'd want to grow this upper jaw. To me, this looks like, if we ran this in the metrics, you'd probably see this patient had a small upper jaw and maybe a slightly bigger lower jaw. But we would want to do movements that would enhance the profile, that would enhance the stability of the teeth. So basically, that's a little bit more about Ceph X-rays and why you take them. Certainly in kids or growing kids, I'm much more likely to take one. I might take one on every growing kid, I think it probably makes sense, especially on class 2 patients, especially on class 3 patients. So that would be more often. If you're working in phase 1 ortho, you're working in kiddo ortho, you need access to a Ceph machine. And again, we can talk a little bit more about, I'm going to do another video after this. We're going to dig into the Cephs a little bit more, and we're going to talk about some options on how to create a workaround if you do not have a Ceph machine. All right, thanks so much. Hopefully this was helpful. Don't hesitate to reach out to us. Go to StraightSmileSolutions.com, send us a message, let us know what else you'd like to learn. And if you'd like to have help on any particular case, you can go and schedule an appointment with us. All right, thanks so much.